Good morning, everybody. I decided to go ahead and make a video. I'm so sick of everybody's posts with so much false information. I went to my friend Michelle's house yesterday. Oh my gosh. She actually started a huge blown up argument over the virus, saying it was the flu on steroids, 10 times worse than any flu, and it was killing thousands of people. She's like sitting there cuddled up in a blanket, hovered up to her chest in her recliner, and got a remote, and she's going channel surfing for news, from one news report to another to another. Guys, stay the hell off from the media. First of all, a lot of what you're seeing on the news reports anymore, you can't believe. And a lot of it is all hyped up to make everybody terrorized and scared to death. Alright, I'm going to read to you, because I've been doing some research. I was going to put this video out a couple days ago, and I was like, no, I don't feel like doing it. Because people, they're not going to listen anyways. They're going to do what they want. And I wanted to do some fact checking, and I decided, well, you know what, I'm just going to go with the CDC, because that's who we're supposed to be listening to, not the president's little cronies who are making up their own little stories, their own little crap, and scaring us and telling us not to leave our houses. Why would the government suddenly decide for the next several months till July they don't want us to leave our house? When the CDC says it only takes 2 weeks if we stay away from everybody for this to pass, just like China did. Okay, now I'm going to bring you up some facts, okay? And this is straight from the CDC. This is not me making up anything. This is straight from their website. From October 1st, 2019 to February 1st, 2020, and these are compiled daily, and then the reports, can be put out, and this is like weekly and everything. At least 12,000 people have died from the regular flu. Okay, from the regular flu as of February 11th, 2020. They estimate 30,000 people will die from the regular flu, not the Covid-19, not this one, but the regular flu. Okay, get over it. A lot more people are dying from this regular flu than this new thing. Okay, by the time that the flu season's over, for the regular flu that we get every year, they say that about 30,000 people will die from the regular flu this flu season. All right. Last flu season, 2018, for the regular flu, not the COVID. The CDC put out their report for 2018-2019. These are the numbers. 35.5 million illnesses and 16.5 million medical visits because of the regular flu, 2018 to 2019. 490,600 hospitalizations and 34,200 deaths during the 2018-2019 flu season for the regular flu, not the COVID, the regular flu, okay? Those are the numbers. 2017 to 2018. 45 million illnesses, 21 million associated medical visits, 810,000 hospitalizations, 61,000 people died in 2017 to 2018 of the regular flu. Okay, so let's go on about the COVID. Are you ready? Here's the facts as of yesterday. They update this daily. Let me show you this. This is their website. And you can see here, I have it pulled up, and it says right here at the top, update dated March 18th, and this is, as you can see, the actual website. They update every day, Monday through Friday. And here's our statistics. Okay, do you see that? Total cases, 7,038. Total deaths as of yesterday, 97. There's no thousands. No thousands. I don't know where everybody's getting all their numbers from, okay? And that is all jurisdictions, including all 50 states, including District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. Everybody's reported and everybody's included in that. And the data includes both confirmed and presumptive positive cases. That means the ones that, they're positive, but they actually don't have the symptoms, okay? And that are reported to the CDC or tested at CDC since January 21st, 2020. Okay, so if you want the actual truth, you go to the CDC site. It's cdc.gov. I think I'll put it in the thing down below. But quit with the hype. Quit getting on Facebook. I have seen, I went on Facebook because I had to sell some stuff, because guess what? There are things that I live on daily because of my disease, and I went to go buy it and nobody's got any. Why are you guys buying so much Miralax and X-Lax? Guys, hello. Sorry, I take that stuff daily because of my disease. I don't go to the bathroom like everybody else. And my Medicaid will not pay for the stuff that they prescribe, but that has so many bad side effects, I wouldn't take it anyways. It just does. So they break it down. Travel related is 269 cases, close contact 276 cases, and the cases that are under investigation as to why they've got it, 6,493. There's still that are open cases that are new, that they're trying to figure out, okay, why did they get them? Probably they touched something that was contaminated. Went to Walmart and somebody snotted all over something and somebody else touched it. And that's more than likely the case. They touched something that was contaminated. So, if you want the truth and you want real information, you go to their website. You don't go through. And I just cannot believe people. Let me go back one more page. And I want to get to I wanted to find, because somewhere it said, oh well, I just hopped out of the whole thing. Alright. How to protect yourself. Let me get my cup of coffee because I'm getting hoarse. Okay, so I've got my coffee and I took a sip and it's very hot. I clicked on know how it spreads. See that? Know how it spreads. And it talks about the best way to prevent the illness is to avoid being exposed to this virus. It's thought to be spread mainly person to person within 6 feet. Between people within close contact within 6 feet. It says so right there. You can click on this. The link will be in the pinned comments of this video. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly can be inhaled into the lungs. Clean your hands often for at least 20 seconds if you're in a public place after blowing your nose, coughing, or sneezing. If soap and water are not available, use hand sanitizer, at least 60% alcohol. Guys, most of the hand sanitizer y'all are buying don't have 60% alcohol. Avoid touching your eyes, nose, and mouth even when I'm out dumpster diving. That ain't happening. And I go to my car and I have disinfectant wipes in the car, and I instantly wash myself off, even my face, and then I wash off my cane. Avoid close contact with people who are sick. Distance yourself between yourself and other people if the COVID is spreading in your community. Okay? This is important for people who are at higher risk. Take yourself to protect others. Stay at home if you're sick, and seek medical care. Cover coughs and sneezes. Everybody should know that. Throwing your tissues in the trash. Everybody should know that. But people don't. Immediately wash your hands with soap and water for at least 20 seconds if you cough or sneeze. Wear a face mask if you're sick. And it says right here, wear a face mask when you're around other people, like sharing a room or a vehicle, if you're sick. Not constantly, if you're sick. If you're not sick, you do not need to wear a face mask. The government's giving out face masks, people. If you're sick. If you're sick. Face masks should be maybe in short supply, and they should be safe for caregivers. True. For caregivers and if you're sick. Clean and disinfect. I see people on YouTube videos wearing those things with the big things sticking out the side. What in the holy hell is that about? Guys, seriously. Clean and disinfect. Any surfaces that are touched daily. I'm the only one that comes in my house. Nobody comes here. But I still clean my toilet. I still clean my bathroom. I did a thorough cleaning in there yesterday. Did it again this morning. I'm the only one who went in my bathroom, but that's okay. I did it anyways. If surfaces are dry or are dirty, then clean them. Use detergent and soap, blah, blah, blah. Everybody should know that, but they don't. To disinfect, it just says use disinfectant that's appropriate for those surfaces. Don't go stupid and use something you shouldn't and destroy your countertops and then say, look at what I did because the government told me. No. And it's telling you how to make a bleach solution and alcohol solutions. It tells you everything. Other common household disinfectants. It tells you everything. It even gives you a complete disinfectant guideline that you can download, guys. Look at that. They're helping us. If you go to the CDC.gov website, they walk you through everything you need to know. Not the hype on Facebook, not the hype on all this other shit. And what to do if you think you're sick. It tells you the actual symptoms, which we know is the cough, the fever, the shortness of breath, all that. We'll click and see if they have anything different. Call your doctor if you think you've been exposed to, develop a fever and symptoms such as cough, difficulty breathing. Range from mild symptoms to severe illness. And, okay, I want you to pay attention to this. The following symptoms may appear 2 to 14 days after exposure. Fever, cough, shortness of breath. And that's it. I'm going through, I'm going to see if there's anything more. Get emergency attention immediately if you have difficulty breathing or shortness of breath, persistent pain in the chest, or pressure in the chest, or new confusion or inability to arouse, bluish lips or purple face. So, well, you know, that's kind of obvious. More information. They have all kinds of things, information here for everybody, from travelers, households, pregnant women and children, people who are sick, caregivers, schools, businesses, healthcare professionals, health departments, laboratories. Okay, stop the spread of germs. They have printable flyers. They have all kinds of stuff in here. All you have to do is go to the actual CDC website. This will clear it all up for you. This will make you realize that you're going through a lot of hype. Sorry, when I do that, the rest of me gets dark. But this is their actual, and you can actually get emailed updates. Look at that. This is from the CDC. Alright, we're going to click on the thing that says reducing stigma. Okay? Knowing and sharing the facts. Look at that. And it says public health emergencies such as the outbreak of coronavirus disease are stressful times for people, and community fear and anxiety about a disease can lead to social stigma. Boy, are we ever seeing that. Toward people, places, or things. For example, stigma and discrimination can occur when people associate with a disease such as this with a population or nationality, even though everyone in that population or from that region is specifically at risk for the disease. Stigma can also occur after a person has been released from quarantine. And then it talks about people with Asian descent. I imagine, anybody with Asian descent is going to be frowned on right now. Some groups of people may be experiencing descent, and they talk about that, like people traveled, emergency responders and healthcare, social avoidance, rejection, denials of healthcare. My doctor's office called me last, Monday? So they're closing indefinitely. My doctor's office. And they led me to believe that it was all of the doctor's offices associated with our hospital. Come to find out, it's only my doctor's office. They have like 4 or 5 offices associated with our hospital. And my doctor's office is the only one out of all of them that is closing. Now, if that didn't raise some suspicion, I'm kind of curious as to why. And I'm not getting answers. I want to know why my doctor's office is closing its doors indefinitely, but yet 1, 2, 3, I think there's 3 other offices besides his that did not close. So it's not associated with the whole hospital saying all the doctor's offices have to close. It's only his. I had to have all my prescriptions called in that may need to be refilled immediately. And that's kind of alarming me because I was at my doctor's office like 2 weeks ago. So, and they're not answering my questions. I want to know why only his. So, anyways, this causes emotional and mental health. Communicators and public health officials can help counter the accurate awareness of the code. You got to raise the actual awareness. Do not continue with all the crap. Okay? Speak out against negative behaviors. People, and that's something I'm going to address. So I want everyone, and I have been, every time I see someone that's working, like I went to Dollar General and the lady cashing me out was wearing gloves. And I said, I really appreciate you for putting up with all of us. I said, I forgot my gloves. I planned on having them when I come in shopping because, and I said, I really appreciate you wearing gloves. She says, I want to because I'm handling everybody's money that they're touching. I said, and I understand that. And I said, and I really appreciate you guys still being open. I said, I want to thank you very much for still being here. And she says, if we aren't, then where are people going to buy their food? So I'm going to hop off here. So the link for the CDC website will be below. And I only have like 3 more minutes that I could talk. So this is what I want to tell everybody. I was on Facebook. And it wasn't just one woman. Now I can't see what I'm looking at. Everything's a blur. It wasn't just one woman. There were like 4 or 5. And I hardly ever use my Facebook. I only go on there to post things on Bidit or on Marketplace. And I get back off. I don't use my Facebook. I haven't since a few days after my mom passed because of all the hate and stuff that I got from, because I wanted to go to her funeral. And I wasn't allowed. But let me tell you, I saw some nasty posts shaming people who did not go out and buy immediately when it was posted on Facebook about how people should go stock up on their toilet paper and buy extra stuff and stock up on everything right away, because we're not going to be able to get anything and we're going to have to be holed up in our house for months. Shaming those of us who did not, and shaming those of us for complaining about those that went out and bulk bought, as she called it. Because she went out and bought 20 cases of toilet paper. And she went out and she bought 10 cases of paper towels. She listed everything she bought and she posted a picture of it. And she had she was shaming people. And she says, yeah, y'all just keep right on yelling at me. I'm going to delete every one of you. And she is she works online for, I won't say the company. But she's tried to get me to join her company for a long time. And I just don't like her attitude. I don't like her. I don't like her attitude. And every time I unfriend her, she adds me back. I've just quit unfriending her. So, but she's always posting negative stuff. And, you know, I just scroll through and ignore it. But that post and other people's posts shaming people is disgusting. You guys need to grow up. Learn the facts. And this money that, quote, we're supposed to get, it's not going to come to those of us who are on disability, those of us who can't afford to go out and pay the high prices that are now being charged for these things that are running out. Those of us I live in a community of 80 apartments. Most of these people here don't have a vehicle, can't go the 5 miles one way and back. Currently, our taxi is still running, but you have to be 60 or older to use it. And don't know when that's going to last. But quit shaming people. Not everybody can go and purchase huge amounts of this toilet paper. Not everybody has the income to do that. Be nice to everybody. Learn your facts. If you hold up in your house, you're going to get sicker. Get outside. Get some sun. Quit being stupid. Sorry. I'm blunt and I'm in everybody's face, and I know people don't like that. But I am who I am. I'm one of the nicest people you're going to meet. But don't get in my face, because you back me in a corner, I'm going to come out fighting. It's just the way it is. It's fight or flight with me, and I've been there too many times. Everybody, I love y'all. Take care. Hope you all stay safe and healthy and happy. Everybody have a wonderful, blessed day. Blessed be, babies. Bye-bye.